on Ramadan Radio 87.9 FM, online at ramadanradio.org, and streaming on Facebook in association with BIMA. So my name's Aisha, and I'm a third year medical student, and I'm currently on placement, and I'm part of the public relations team with BIMA. And today we're going to be covering what the latest is with COVID. So Dr. Zarba will be taking the hot seat, and I'll be questioning her today. Before I let her introduce herself, if you have any questions throughout the show and you're listening on YouTube or Facebook, please just message them in. However, if you are listening on the radio, this is a recorded session, so don't message if you're listening on the radio. So Dr. Zarba, I'll let you introduce yourself.
Assalamu alaikum. My name is Dr. Zirva. I'm a GP in the West Midlands, so I'm not actually from London. But myself and Aisha have been kind of organising these health shows since the start of Ramadan, and I'm really sad to think that this is the last show now. Alhamdulillah, it's been a very quick month, a very busy month with lots of useful health related things that we've spoken about. So yeah. I think this will hopefully sign it all off.
Perfect. Okay, so I'll go straight in with the first question then. So what are the most up-to-date guidelines for COVID right now in terms of mixing?
So that's a really important question now that Eid is coming up. And the guidelines at the moment state that you can meet up with up to 6 people from different households outside, so in your garden or in a park, or some kind of outdoor public place, or 2 families. And they've not put a number on the amount of people in those families. Before they used to say 6 people in total, whereas now they say 2 families. So again, those 2 families would be the same as with that group of 6, which would be outside in a public area, like in a park, or in your own kind of private garden. And inshallah, on the 17th of May, that is due to become even more relaxed. So those 6 people or those 2 families should be able to meet indoors, so inside of your house. Yeah.
Great. So yeah, I think it's going to be quite difficult with Eid coming up. I think everybody's going to want to see everyone, but yeah, that currently is the guideline at present. Okay, and could you maybe tell us a little bit about what's going on in India? So the strain there, because I know that's been quite topical, quite in the news recently. So what's been going on with India?
So even though it's happening in India, I think it's something that we all need to be kind of really attentive about. There seems to have been a lot of press in the media, but it can feel a bit overwhelming when you're kind of looking at numbers and figures and seeing what's going on in a different country and then comparing it to what's happening here. So unfortunately, India has been hit with a tsunami of kind of coronavirus cases. And not only that, the particular strain that's become kind of wildfire in India is just... They say from the studies that they've done on this particular strain, out of the strains that we've had in the UK, this is probably going to be the fastest spreading one. Now, we've had some other kind of strain mutants and mutations in strains. So where the strain changes, so where the outside of that virus looks slightly different to your body. This is a normal thing that happens. That's the reason why, for example, we would have a different flu vaccine every single year. I suppose in the case of the coronavirus, we can see what's happening in India. They've got a really, really kind of high case number every single day. So it's about 450,000 a day at the moment. And their deaths so far are really high as well. I think in total there have been about 21 million people who've been affected by coronavirus, and just under 19 million have recovered. But that does mean that they have a huge number of people that have died. And bearing in mind, in countries like India, they don't actually tell us the full number of the amount of people that are dying, because they don't have the strict protocols in place to register deaths like we do over here, or diagnose the deaths. So I know, for example, speaking to people in Pakistan, when coronavirus spread quite a lot there some months ago, people were always scared of having that put on the death certificate. People would come up with some other excuse, like a sudden death, it was a heart attack or something like that, because of the stigma and shame that there is there. But I think any of us, I'm not from India, but I've got lots of friends from India, and I've spoken to all of my friends that I've spoken to. They know at least one person or one family that has been affected by coronavirus. They know at least someone who's died from coronavirus in India. So it's feeling very similar to how it was when we had it quite bad. But as you can imagine, the scale of it is so much more over there. We can't ignore factors like there are multiple people that live in one household, especially in areas of poverty, where the poor people live in kind of smaller areas, small houses, lots more people, lots more crowding. And unfortunately, they've just not been able to have a lockdown like what we can afford to do. And I read something really interesting the other day. A lot of people say, oh, it's just easy, just lock them down. Just like we had a lockdown, it worked really well. The problem with a lockdown is you need to be able to afford a lockdown. Alhamdulillah, we live in a country where the welfare system supports us to a great extent. It's not perfect. There's things that could be better about it, but it's the whole reason why we've, alhamdulillah, managed to get through as much as we have. The furlough schemes, things like that, you need money for that. Unfortunately, countries like India just cannot support the amount of people that are there, so they've not been able to kind of crack down as much as we could. And the other problem is they've not been able to kind of ramp up on the vaccinations like we have. So alhamdulillah, over here, 70% of the adults have actually been vaccinated now, which is incredible. There's probably 2% of the population over there that have had both the doses of the vaccine. So they've obviously got a lot of work to do yet.
Yeah, no, it's quite crazy how different the statistics are between sort of the situation in the United Kingdom versus in India. But as you said, the socioeconomic situation there is very different. The hygiene, of course, is different. It's a lot more overpopulated. So, of course, the situation there is going to be a lot more difficult. But, is that something that we should be worrying about here in the UK, this new strain? Because obviously it did spread from China previously. Is that, what's your sort of standpoint on that? Do you think it's something that we should be stressed out about or concerned about in any way?
I mean, I think just like with all the other strains so far, I think we all just need to be careful. Though our restrictions are easing, we should really still try to stick within those restrictions. And the reason for that is because just like with every strain that we've had so far, alhamdulillah, the strains so far that have passed us, what we found is that being vaccinated has still meant that even if we have been tested positive from those particular strains, that actually we haven't become that unwell from it. And that's the aim of a vaccination. The aim of a vaccination isn't to say you will not get coronavirus. It means that if you do get coronavirus, that you will be affected much more mildly, and inshallah, not be affected so severely that you are at risk of dying. Now, the particular strain from India, what we don't know so much about that is how it will affect us in terms of being vaccinated, because whenever these new strains come out, it always takes us a little bit of time before we see whether the kind of vaccination program and the fact that all of us have been vaccinated, is that enough to protect us? They are hopeful, but that's not to say that we should become completely relaxed. And we should still be following the guidelines at the moment.
Okay, perfect, thank you. And so with Eid coming up, how can we all sort of be COVID safe? Because I know you're saying it's really important to stay within sort of try to follow the guidance as best as we can, and even with the new strain in India, and just but with Eid coming up, what sort of what can we do to sort of protect ourselves in the best way possible?
So that's a really good question, and that's obviously really, really important right now with us being so close to Eid. The restrictions are easing. We have so much positivity around coronavirus right now. So with Eid, I mean, the difference this time in comparison to, for example, the very first lockdown, and remember, we were in the middle of our first lockdown when our first Eid happened last year. And also we had just sort of started to ease out of lockdown when we had our second Eid last year. So it was a very different world then, and alhamdulillah, we are in a better place at the moment. So now a lot of mosques are open, majority of mosques are open, and they've got appropriate social distancing there. You know, they've got between each kind of area of prayer, there's like a gap. So there's about 2 meters between everyone who is praying. People still have to have their face mask on. And the prayers are quite quick. So you kind of come in, you know, they quickly do the prayer. There's no extended prayers, and then people leave. So when, you know, mosques will be open, I think it's a personal choice whether people want to go or not. Some people still don't feel comfortable going to the mosques right now. That's entirely up to them. I don't think anyone should feel under any pressure to go. Equally, it's been a long time since people have seen other people, and we all know going to the mosque, especially for our elders, it's you know, it's just their place of, you know, worship, meeting people, connecting with each other, and they've really not had that in the last year. So for anyone who does want to go, all I would say is just make sure that you follow the rules over there. So, you know, keep your distance, have your face mask on, make sure you've washed your hands before you go in. And most importantly, just be really careful when it comes to sort of shaking hands and greeting people, because of course right now we're not allowed to do that officially, especially with people from outside of our household. I know people will feel tempted by it, but I think if we want to be completely COVID safe, these are just things that we have to be mindful of. So inshallah, you know, that's mosque wise what we should be doing. If we do choose to go to a mosque or an area where there's going to be congregated prayer. And then the next thing is, you know, in the evenings or at lunchtime when we all go, and normally we would see our families and, you know, enjoy and celebrate Eid together. Bearing in mind the coronavirus sort of government guidelines at the moment, like I said before, 2 families are only really allowed to meet outside, or a maximum of 6 people. So if, for example, you do make plans to go into inside someone else's house, though that wouldn't be permitted under the kind of usual rules, particularly because, you know, day to day, where people are actually allowed into each other's houses is more related to, you know, the kind of, what do you call them? Bubbles people have, support bubbles, childcare bubbles and things. Eid, that doesn't really count as much because those bubbles aren't, you know, your childcare bubble. You don't need your childcare bubble on Eid kind of thing. But inshallah, I hope and pray everybody makes the right choices. But kind of loosely speaking, that is what the government's saying.
Yeah, I think it's very difficult because it's that sort of balancing act between, you know, we haven't been able to pray, we've not been able to, and as you said, you know, that is the place for especially the elders to have that connection to Allah and also connection to people. It's they haven't had that for a really long time. So it's that balancing act between, you know, wanting to psychologically help yourself and spiritually and make yourself feel better from that sense of things, but also wanting to protect yourself and weighing out the risk of COVID. So I guess the other thing is, you know, it's about what sort of risk category you fall under. So, you know, are you type 2 diabetic, how old? And like with that also being that little bit more cautious, I guess, when it comes to sort of going into mosque, into prayer. But, you know, like you said, there are restrictions, there are guidance as to how it can be done by keeping that distance and having the face mask on, and the fact that it is short. So I guess people can feel a little bit more at ease knowing that, you know, these rules there, this guidance there in order to protect you, to make it as safe as it sort of possibly can be, in order to still go and worship and have that connection to people again, because it has been so long.
It has. And you know what's really hard, and I know I've had a few people say to me, well, the restrictions are easing on the 17th of May. It feels so cruel because it's literally days away from Eid. So people are like, well, we can start our 17th of May earlier than the 17th of May. And obviously, if we are sharing the government guidelines, I think tomorrow, from what I've heard, there is going to be like an additional thing that they are planning to relax as well, in addition to what we know about the 17th of May already, which is the sort of indoor mixing. So that's worth kind of having a listen out for. But it's really hard because I think it's human nature, like you said. we've missed each other so much now that restaurants have opened, like people are able to kind of eat outside. People are really, really starting to like remember what it's like to be around people and to be around their loved ones, you know, people they've not seen for like over a year. It's really tough. And Eid is like, you know, I always explain it to English people as that's the equivalent of our Christmas, you know, where everyone would get together and they'd all give each other presents and they would all kind of have family time together. Eid is that time, Ramadan is that time for us. And we've had to do another Ramadan this year, which isn't anything like the Ramadans we've had before. So inshallah, I pray that Allah just gives us the sabr and patience to get through this time the best that we can.
Yeah, it really is a case of, you know, having a bite of a cake but not being able to eat the whole piece. So it is very difficult. But I guess, like you said, you know, inshallah, they will have a bit more lax guidance for tomorrow. But I guess we'll just have to wait and see what happens with that. But the guidance you've said is what's current guidance up to date. So that's the situation now. So in terms of Eid, I know you sort of touched on it. So is it okay to mix for Eid? And if so, sort of to what extent?
So inshallah, let's hope that we've got good weather this Eid, because I think if we've got good weather, then we can mix a bit more freely. So strictly speaking, you can meet with 6 people, you know, from different households outside, or 2 families outside. Now, there aren't any specific guidelines to my knowledge, although I'm happy to be corrected, about how many times you can meet people outside as kind of groups of 2. So say, for example, it's a very good day and you have one family that comes, spends a couple of hours and then they go, and then another family comes and spends a couple of hours and goes. That would actually be permissible. But if you had like 3 or 4 families together, which, you know, often during Eid, especially with like, for example, people who have siblings and they've got children and they all want to go to their mum's house at a particular time, that won't be allowed, unfortunately, under the government guidelines. It feels awful. It feels awfully, because like you don't want it to be like that. I would wish we were like 1 week ahead, just so that there would be a little bit more freedom in terms of mixing. But the government guidelines are as that, unfortunately.
Okay. And so we've just sort of gone a little bit over our halfway point, but for listeners who have just joined us, you are listening to the BIMA Health Show with Dr. Zarva and me, Aisha Abbas, on Ramadan Radio 87.9 FM, online at ramadanradio.org, and streaming on Facebook in association with BIMA. And if you are on Facebook or YouTube, feel free to jot down any questions. However, if you're listening on the radio, this is a recorded session, so please do not call in or attempt to send any messages. So final question then for you is, when are the next restrictions easing being enforced? So you did mention it's in the next sort of week or so, but is there any sort of other information you can give about that as of now?
So the next, like I mentioned before, the next restrictions easing will start from Monday, the 17th of May. So that's not tomorrow, that's the Monday after. And what the government have done is they've done it in sort of phases of 5 weeks. So every 5 weeks they've done some more relaxing, some more opening, some more easing, that kind of thing. Alhamdulillah, so far that their plan and strategy is going well. My understanding is the reason why they've done it like that is so that, for example, the vaccination program, as that starts to kind of really accelerate, when we start easing things slowly, it should mean that the cases don't rise as much. It should mean that the deaths and the hospital admissions don't rise as much, and things like that. So like I mentioned before, on the 17th of May, there may be some changes which are going to be announced tomorrow, so it's worth keeping an eye out for. But other than that, it would be basically 2 families would be allowed to meet inside of the house, which is it's been a long time since we've been able to do that. I think it's before Christmas. They were temporarily allowed on Christmas Day, the last I remember. So it's, we're how many, 5 months down the line. It's been a long time since it's been allowed. A lot of people have been following the rules, so this is going to be really welcome news for them, inshallah. So that's on the 17th of May. And then on the 21st of June, which is the 5 weeks after that, it's hoped for that essentially all of the restrictions will be eased to a great extent. So you can mix with as many people as you want, you can have as many people over as you want. the main restriction that's sort of left after the 21st of June is travel. So travel is a bit of a problem right now. Like I've not been on holiday for a long time. I can't remember the last time I went on holiday because it's I don't know about you. When was the last time you went?
Well, to be fair, it was about a year ago, so it wasn't too bad for me.
You caught it in the nick of time then.
Literally just that little 2-week gap that we were allowed to travel, I managed to go away for that. But you know, it is difficult because the situation is just so different across different countries. So it's you know, it's difficult to, you know, I guess I'm assuming, to predict when that's going to sort of ease off, and also what countries it will ease off to, because already, you know, even now you've got this whole red zone. You know, you in certain countries it's fine, but somewhere like Dubai, it's, you know, if you're there you're stuck, sort of thing. I know I've got a couple of cousins there, so it's but sorry, continue.
It's really tough because like the UAE is a very popular place for a lot of Muslim people to travel. It's relatively affordable. The flights aren't always that expensive, and also you have these kind of all-inclusive hotel stays, resorts, and just amazing halal food.
I was going to say the most important thing is the halal meat.
Obviously we are fasting, so we're probably feeling it a little bit more when we're talking about it, but alhamdulillah, like those are the things that a lot of people are really, really missing, and I have no idea when that in particular is going to start easing, because like you said, we just don't know what's happening in other countries. Now UAE for us is such a commodity for that reason, but then for people for example from India or Pakistan, who are traveling this way into the West, it's kind of a midpoint for them, and the UK government has to really take into consideration the risk from the other country. So if India is, you know, so high in coronavirus, and there are people still traveling out from India, potentially traveling through the UAE, that puts everybody in the world at risk, whoever else is traveling through those airports. So that's the reason why they've got the really strict sanctions, like the £1,750 or something like that you have to pay for a hotel stay for 10 days. It's really tough, and not many people can afford that. And they know that, which is why they want to enforce that, so that it's a deterrent for people that are going abroad for coming back. Previously, people were using Turkey as a bit of a bypass route, and obviously that's now in the red zone as well. So unfortunately, this is our main barrier right now, in kind of returning back to that normality.
Yeah, and I think, you know, like you were saying, this 5 weeks sort of easing off restrictions little bit by little every 5 weeks, it has definitely made a difference, because, you know, we've seen cases reduce significantly, and you know, obviously it would be a shame if, you know, if restrictions were to ease off too soon, and for, you know, all of a sudden for it to spike up again. So you know, I think inshallah it will ease off over time, and we'll just have to wait and see what the situation is, inshallah, in sort of around the 21st. But yeah, so you've answered pretty much all of the questions, Dr. Serva, so thank you very much for that. I think that pretty much concludes everything. Do you have anything else that you want to sort of add in?
Apologies, that's my son trying to come through and get one of his toys, and he's having a go at me as well. So thank goodness for mute function. No, I think that's kind of coronavirus in a nutshell. We definitely don't have as much to talk about with coronavirus as we did, which is, it is what it is, isn't it? Alhamdulillah, we're in a position now where, you know, I don't think people feel as afraid to go out, you know, to the supermarket. Do you remember there was a time where going to the supermarket was actually really scary? Yeah,
especially I remember I was living with my auntie and uncle during that time, and my cousin was right next door, and she did all the shopping, because there was you know, it took ages before they felt comfortable to sort of even do something as basic as going to the supermarket. But you know, it might not be, it's definitely not the worst thing that there's not as much news now about COVID, about, you know, the virus, because, you know, like you said beforehand, it was very much the bit, everything was new, everything was it just felt like complete mayhem. But I feel like sort of a year down the line, everything has sort of started to ease off. We've seen the reduction in cases, we have a lot more knowledge, we've got the vaccine, massive vaccination programs, and, you know, bit by bit, inshallah, it will get better, because we are seeing that improvement, and inshallah there won't be another spike again, and we will be able to go on holidays and, do everything that we just miss doing and have a bit of normalcy to our lives again.
Inshallah. I mean, there is lots of kind of the statistics, the numbers are really, really reassuring. So we seem to be on a static number of cases every day, roughly about 2,000 cases. But our hospital admissions are very little. And our death rate is probably the lowest I've known of it since the start of the pandemic. We're talking about the very first few days. So alhamdulillah, the efforts of everybody are really, really paying off, and we can't underestimate the importance of the social distancing and the kind of wearing the face masks and sanitizing our hands, because we've had to make that like part of our day-to-day routine for it to be effective. But equally, the vaccination program, it's incredible, alhamdulillah. I really, really hope it stays to what it is, because everyone can see this glimpse. Like you said, it's like having a taste of something without being able to enjoy the whole thing. And all we can do is make dua that Allah gets us out of this mess as soon as possible, so we can enjoy seeing our family and loved ones again, inshallah.
Definitely. No, and like you said, hospital admissions especially, I remember when I first started placement, there were whole wards just dedicated for COVID, whereas now it's just the odd patient here and there. I mean, I have moved hospitals from Bath, which is a lot bigger than Western-super-Mare, but even then, I know the situation here was a lot different a couple months ago, and bit by bit you can see the reduction. You can see even like hospital staff just a lot more at ease about COVID. So alhamdulillah, it is getting better, and inshallah the situation will continue to get better. That's all inshallah. We can pray for now.
Inshallah.
Well, do you have anything else to add, Dr. Sarva?
No, apart from thank you everybody who has joined us for our shows kind of across the month. I hope they've been informative. We do hope to do this again next Ramadan, inshallah. So if anyone does have any suggestions of shows or topics or anything like that, then please do get in touch with Ramadan Radio. They will forward it to us. But apart from that, a very early Eid Mubarak to everybody who's listening and not listening. Anyone who's celebrating, not celebrating, it's a happy time. There's positivity to look forward to, inshallah, and I hope everybody can enjoy it in the safest way possible, inshallah.
I couldn't say it better myself. Eid Mubarak, everybody. Jazakallah khair, and thank you for listening to me, Aisha Abbas, and Dr. Zarva on Ramadan Radio 87.9 FM. Till next time, Assalamu alaikum wa rahmatullahi wa barakatuh.